Excellent. Welcome, everyone. We're really delighted to welcome you to our second webinar on the topic of misinformation. Thank you so much to those of you who are introducing yourself in the chat. We would welcome you to do that and let us know where you're zooming in from. This webinar will focus on community engagement to tackle misinformation about adolescent pregnancy prevention programs. We recently had a webinar in November that talked about some of the science behind misinformation and how and misinformation specifically within public health. And if you haven't had a chance to view that webinar, that will be up on the exchange this week. So I invite you to take a watch if you'd like. We're really excited to welcome our speakers today. We're joined by Kaylor Garcia and La Shantinia Clayton. Ms. Garcia is a health communication specialist at Child Trends with a decade of experience providing dissemination and communication guidance to federal, state, and non-governmental agencies. She is also the project director of the CDC-funded Leadership Exchange for Adolescent Health Promotion, which some of you might be a part of, and it supports state teams in improving policy and practice around sexual health education, sexual health services, and safe, supportive environments in school. So we're really excited to learn from her expertise. And Ms. Clayton serves as the program specialist for Georgia State PrEP Grant. She's responsible for the oversight, coordination, and evaluation of over 11 subrecipients that implement PrEP programming across 15 Georgia counties. She has over 5 years of experience in sexual health education and pregnancy prevention, and will share some of the strategies that they are using across the state of Georgia and within their 15 counties to support the PrEP programming. So now at this time, I'm going to turn over the presentation to Kaylor to get us started. Thank you so much. And you are still on mute.
Thanks, Katie, for having me. And it's a great pleasure to be here with you all. Just to go over our agenda quickly for today, we're in the middle of welcome and introductions. We'll kind of go over some messaging best practices and then do some breakout practice. And then we'll talk about a little bit of stakeholder engagement and then have a grantee spotlight and end with Q&A. Our main objectives are to kind of describe the current misinformation landscape around adolescent pregnancy prevention efforts, describe the kinds of messaging that can either prevent or address misinformation, identify your key stakeholders, and discuss strategies for developing and disseminating messaging about adolescent pregnancy prevention programs specific to their stakeholder groups. It's great to see people from so many different communities. And one of the big things about communication is just kind of tailoring to each individual circumstance. So we hope that this presentation is one that is interactive and engaging for you all and provides a lot of great content. So to start, I just wanted to get a baseline for people's knowledge coming into our discussion today. So on your screen, you're going to see 3 polls, and if you could please go ahead and take a couple of minutes to answer them. This is super interesting. I wonder if, so I'm going to go ahead and close out the, well, actually, if I end the poll, will it show people's answers or no? Oh, here we go. I think
it's sharing now.
Oh, it's sharing. Great. Thank you. Yeah, so this is good. It looks like people by and large do know the distinction between misinformation and disinformation. So we'll cover that a little bit more, but they're both very similar, but disinformation is the one that is purposefully intentional and really trying to make sure that the wrong information is out there. And then it was interesting to see the answer to question number 3. And this actually came from the Institute for Public Relations, which is one of the main sources for this presentation. But the percentage of people in the US who rarely or never check an alternate source to verify information is actually 19%, which no one guessed. But the good news is people had guessed things like 72 and 56%, which luckily it's not quite that bad. Only 1 in 5 people aren't checking alternate sources to verify information.
Hey, Kayla, we're having trouble seeing the results. Would you mind just walking through them verbally?
Sure. Yeah. So can you see them now? So basically 83%.
No, it's just like a black box on your screen.
Oh, okay. That, all right. Oh, Kayla can see them. That's interesting. Okay. Basically 83% said that misinformation is information that is inaccurate or misleading. And then we had like a little under 10% with the other 2 choices. So most people picked the correct answer for question number 1. 76% picked the correct answer for question number 2, which is that disinformation is information that is intentionally inaccurate or misleading. We had 20% kind of thinking that it might be the mindsets based on inaccurate or misleading facts. And then finally, for question number 3, I don't know how, like 90% of people picked either 72% or 56% as saying that the percentage of people in the US rarely or never check alternate sources to verify information. Yeah, that is, those were the results, but 19% is the correct answer. All right, so I'm going to go ahead and advance us to our next slide. Thank you everyone for participating in those polls. Again, misinformation and disinformation largely look the same on the outside. So what is being shared is inaccurate or misleading, and the information is presented in a way that can feel confusing, or it requires people to dedicate a lot of attention. In other words, it's a high cognitive load. So basically, the more that we have to process, especially when there are other things competing for our attention, the more we rely on mental shortcuts to evaluate the information. These shortcuts include things like whether a messenger seems trustworthy, does it seem familiar, does it align with what we already know and believe. In essence, people who spread misinformation and disinformation rely on the fact that there's a lot of stuff out there to process and that it takes a lot of effort to process. So audiences won't look too closely at what's being shared. I think the primary difference between misinformation and disinformation is that someone spreading the information spreading disinformation is doing so purposefully or strategically because they benefit in some way. And that benefit can be money, political power, or even fame. People sharing misinformation don't necessarily have that intent. So for example, a person can even share misinformation to see if it's true or not. So someone said, I heard this rumor that X, Y, and Z happened. And so that person isn't necessarily trying to mislead people, but because they've repeated the misinformation, it's getting out there. The good thing is that most people probably fall into the bucket of misinformation. And it means that that's a good thing because there's an opening to clarify or correct their information. And so in thinking about addressing misinformation in your communities, you want to target your messaging toward the people who don't have strong feelings or just maybe uninformed so that the overall perception of your programs is accurate. And so as mentioned in the objectives, one of the things that we want to talk through are what does the landscape currently look like around misinformation and adolescent pregnancy prevention? So it's a challenge in multiple sectors. If you were in the November webinar, you heard a little bit about how misinformation is happening generally in public health. I know many of your prep and SRE programs are facilitated in or through schools. And here are just some of the headlines and news articles about mistrust in schools specifically, particularly around sex education. These headlines came and quotes kind of came from both national and local news sources. And I also wanted to note that the discussions aren't limited to pregnancy prevention programs or even sex education broadly. They are also starting to encompass things like data collection and social emotional learning. So beyond providing some exemplars of the messages out there, I think these quotes especially also display what we mean by high cognitive load as well. So for example, this quote on the left raises a lot of highly charged topics such as sexual grooming, sexual assault, and mental health struggles. And so raising people's emotional state is one example of extra processing. In this quote on the bottom, we see a lot of big words and it relies on a lot of technical knowledge. I mean, it's part of a court document, but it is interesting to see that this quote is the thing that's being allowed to circulate and shape the story about sex education in this area. And so I'm actually going to pull up the Mentimeter for this. I'm realizing now I should have pulled it up earlier. You're going to see shortly a website that has that kind of cover. It will allow you to share your thoughts and perspectives. All right, so I think it's loading. If you go to menti.com and use the code 1716 1764, it'll take you to a kind of like a little checkbox and you can like provide rating scales. And we want to rate first how informed people are about your adolescent pregnancy prevention programs and whether their overall feeling towards your programs is positive or negative. So someone can be misinformed and feel positively about your program. It could be that they like the idea of adolescent pregnancy prevention, but they don't feel like they're eligible, even if they are. Similarly, someone can have very negative feelings and be very informed about your program and have, it could be something like maybe they do know what's being taught, but at the same time, they don't really agree with it, or they have a different preference or what should be covered. So I think generally we typically think that people fall into these buckets of either positive and very informed or misinformed and having very negative emotions, but that's not always the case. So for each of these groups, I would be curious to see kind of where you feel people are. Ooh, this is exciting. So we have, it looks like it's adjusting as people are voting. So this is kind of an average across your different programs.
Hey, Kayla, I'm not sure if you can fix this, but there's a black box on the top of your screen. Is there something that's telling you about captioning that you can close the X?
Yes.
Can you close that?
Yeah. Thank you.
Perfect. That looks a lot better. Thank you.
Right. So I think about 20%. Okay, people are still going. Interestingly enough, it does look like predominantly it is following the trend of the more misinformed you are, the more negative you feel. And the more informed you are, the more positive you feel. I am glad that your program providers are both very informed and feel positively towards your program. It looks like generally parents are kind of neutral on things, but maybe on the more misinformed end. It seems like youth and community organizations kind of seem like they're in a similar boat in terms of level of informedness, but skewing slightly more positively. And then school leaders are a little bit more informed and a little bit more positive. But it's interesting that most people kind of hover in this like neutral-ish territory where it's like they might be getting a little bit of, they might have some information, maybe some of it good, some of it bad, and like generally speaking are in the neutral to positive category. But you can see, so I think if I'm hovering over any one of these, this gives you the spread of the votes so far. And about a little under half of you, I think, have responded, or maybe a third have responded at this point. And so there is like a wide variation of like what the votes are. So some people have like really good state leaders, and some people, it looks like a lot are pulling on that negative and misinformed side. All right, so I'm going to pull back up the slideshow. All right, so now that we've covered some of the basics about misinformation, we're going to take a look at how it's being applied to adolescent pregnancy prevention programs. And we're really just going to focus on what we can do to address it. Misinformation is not new, and there have been research on ways to combat it. So we're going to start with taking a look at stakeholders and audiences. As someone who works in communications, I feel like a distinction that I generally like to make for my clients is that while messages can reach anybody, they are not always for everybody. People have different reasons for being interested in information and different actions they can take once they have information. So understanding who you're trying to reach is essential and forms the basis of your approach. And so there are a lot of stakeholders who either have a vested interest or control over adolescent pregnancy prevention efforts. Most of the funding for FISB's adolescent pregnancy prevention programs flows through a state or tribal entity. And at that level, here are some of the agencies, offices, or departments that may be interested in your FISB program, either because they're the ones directing the funding, they have a related program, or they help facilitate a program. And we also want to note here tribal entities as well. So we have both states and tribes that can be engaged. So these are kind of organization-wide entities. In addition to those, there are some individuals or non-governmental stakeholders that may also have an interest in or influence on your adolescent pregnancy prevention programs. So that can include people like the governor or the state superintendent, the state health commissioner, a state parent-teacher association, advocacy group, public universities and colleges, anybody that's still operating on that upper level, but like not necessarily tied to the government agency. And while funding for adolescent pregnancy prevention programs may be provided at the state level, that funding often flows down to subgrantees that are working locally. And that leads to a whole other set of stakeholders. So here you can see we have local education agencies, local health departments, school boards, health providers, superintendents, and community-based organizations. And then much like at the state level, in addition to organizations with a vested interest in adolescent pregnancy prevention programs, there are likely specific individuals who are interested in your work, either because they are directly responsible for carrying out the programs or they're the beneficiaries of that work. And so here, parents and youth, I think we could kind of group together as potential beneficiaries, and then school staff, social workers, and health providers, I think, might fall into that camp of who's responsible for carrying out programs. So that's a lot of different audiences and stakeholders and people who are hearing messages about your program and who you could be trying to reach. And so knowing that there are little limited times in the day and that there are only so many resources, it does become necessary to prioritize stakeholders. And so when you're doing that process, there are two different questions that you kind of want to ask. The first is who makes the decisions, and then who has the ear of decision makers. And this prioritization process is really important so that you can tailor things like speaking to values or understanding what particular gaps need to be filled, to tailor that to a specific audience. So we're going to do another Mentimeter again. Let me pull up. I think this one will be a different one. So, oh, no, that's not what I want to do. All right, it's pulling up. And so we're going to start with first kind of saying who is driving the conversation about your adolescent pregnancy prevention programs based on the different stakeholder groups I provided. So if you go to menti.com and use the code 75977341, you should see the question. And so basically vote on which groups you think are influencing the conversation the most about adolescent pregnancy prevention programs in your communities. And we'll take a couple minutes there. Got a lot of, well, one person has said that state level agencies. All right, so it looks like things are stabilizing a little bit. It seems like the primary groups driving things are agencies at the state and local levels, and then community-based organizations coming in third. And then we do have some contingents. So state leaders like governors or superintendents and advocacy groups might be doing it, but then local leaders, parents, and youth are kind of smaller entities. All right, great. So this is going to be more of a word cloud. So thinking about those decision makers that you flagged just now, who are the best messengers to reach those people? And I think it's still the same code. So I think this is just a type in scenario. Great. It looks like youth and parents definitely seem like very big messengers to decision makers. With youth, actually, they seem to have like equaled out a little bit now with who's responded, but I think we're still getting some votes in. Yeah, So it looks like youth seem to be the biggest messenger, followed by parents, and then maybe educators. Someone said, I don't know, and that's perfectly valid. I think sometimes that takes a little thinking to figure out kind of who are the best, who is making those connections, and who can be the right kind of person to reach people. So yeah. We also have Congress and the president up here. I think a couple of votes for community health nurses, and I think CHW is community health workers. If that's not correct, please let me know. But yeah, so a variety of people, but it does seem like the people who most benefit from the program are the people who can potentially be the most influential to those decision makers. All right. Thank you, everyone, for sharing your thoughts and kind of engaging in this stakeholder exercise. So we've figured out our stakeholders, and now it's to the point of crafting messages. As I said before, misinformation is not new, and there is a significant amount of research done on how to address it. Majority of this research comes from the crisis communications field. So we're going to cover some tips from the Institute for Public Relations, which is a nonprofit that aims to increase the use of research-based knowledge in the field of public relations. And this first round of tips deals specifically with the elements needed to create messages that effectively tackle misinformation. All right, so our first tip is to balance being concise with providing enough detail to address the wrong facts. As we talked about earlier, one of the things that makes misinformation so quote unquote sticky is that it uses that high cognitive load to force people to take mental shortcuts. And so for this reason, whenever you're talking to address misinformation, you want your message to be as direct, simple, and brief as possible. So what does that look like in action? We have a little screenshot here of a potential way that misinformation might be shared. So social media is one of those big places where people might see misinformation. And what counts as concise will kind of vary based on how you're sharing the information. So that kind of gets to this first point here. You want to match the amount of information to your platform. So for social media messages, you have to be a lot more concise than if you're having a conversation with stakeholders or you're giving a presentation. So being mindful of where and how you're sharing the correct information can help you to gauge how much to cover in your messaging, which kind of gets to your second point, to the second point here. You may not be able to address every single bit of misinformation, so it's going to be important to pick with the amount of space you have, what is the thing that you want to tackle the most? I know in this kind of like cartoon graphic, we have the State Department of Health responding on someone's personal social media account. I did want to flag that this probably will not be the norm for you all in terms of your state agency directly responding, just because that might open up to more scrutiny. But if, let's say, you decided, okay, we're not going to do a comment like this, but we're going to still have a post on social media about this topic, the same kind of rules would apply. The second tip for creating a message that addresses misinformation is that we want to fill in the gaps about why or how something is occurring. So basically, this is also known as providing alternate explanations. So often people adopt misinformation because they don't have a lot of inside knowledge or details about an issue, and the misinformation is speaking to that gap. So filling in those gaps with an alternate explanation helps people understand the new piece of information that they're getting. And so here we have these 2 points of you want to provide direct rationales and use relatable examples. And we have here like a sample conversation between two people. So the person on the left here is saying, well, if we're providing sex education in the 2nd grade, doesn't that just mean we're expecting kids to have sex early? And this person is trying to correct this other person's perception by saying that it's about laying a foundation. So the alternate explanation is this piece of laying a foundation just like any other subject. And they're using they're providing the examples of the content. So naming body parts is something that you would cover maybe in 2nd grade in your standards. And then using a different example, but something that they could understand, like saying you would want to teach addition before algebra. So that's kind of what tip 2 could look like in practice. All right. The 3rd tip is that this is providing proper context by highlighting why a claim is wrong. So one of the tricky things about misinformation is that one of the mental shortcuts we use to evaluate something is whether we've heard it before or not. So even a single exposure to misinformation can already begin to shape a person's perceptions about a topic. So for that reason, it's really important that misinformation isn't repeated unless you're specifically saying why it is not correct. And here are how that looks like in practice. So the first is pause. Like if you see misinformation, pause before repeating and responding, and then you want to lead with the correct information. So let's say, for example, that one of the pieces of misinformation that you see is someone says, oh, we don't engage parents in these programs. And if you say something like, I can't believe they said that, or look at these wild statements without providing detail about what the correct information is, the person who you've communicated to won't have the right context to refer back to. And so they'll remember maybe that it's inaccurate at first, but then over time, they'll just kind of maybe forget and then just remember the original statement rather than the fact that it's not correct. So if we're taking this example of someone saying, oh, parents aren't engaged, instead of saying, I can't believe they said we don't engage parents, you would want to try something like, actually, parents are regularly engaged with a program they volunteer with and provide feedback on the curricula. So that isn't a true statement. And that's like the subtle difference between those two things. So we've covered quite a bit about what should be included in the framing of messages. And this next tip helps with the presentation of that information. So graphs and visualizations can be a great way to share information. They are attention getting and they can be quicker to take in than a large block of text. That being said, there are still tips for how to present data in particular clearly. The first is you kind of want to keep it simple. So keep it to one point and use graphs and visualizations that make sure to provide enough contextual information. You also, when you're making graphs, want to make sure to follow good design principles that ensure data can be well understood and isn't misleading. So these include adding in clear labels, making sure axes start at 0 or have the appropriate scale. And it also can be helpful to think about accessibility and people's associations with color schemes. So for example, if you're using something like red and green, don't make red stand for good and green stand for bad, because then that kind of messes with people's associations of those colors. And you really don't want to overload a single graphic. So in this case, we're presenting one fact here. We have this one stat of 27.4, and then we clarify it to kind of say 27.4 is about equivalent to just over 1 in 4 youth. And we have the little people on the side to kind of highlight that. And you'll notice we're kind of using more neutral colors here, nothing like red, green to kind of, that might have people associated with a specific emotion. And then our last tip goes back to framing again. So misinformation is more likely to stick when it matches how we view the world. So when we're offering corrected information, it can be really helpful to affirm your audience's sense of self by finding that common ground or acknowledging where they're coming from. And so tip number 5 in practice. This means that we're thinking about our audiences as partners and not adversaries, and getting input where possible. Katie mentioned at the beginning that I'm part of the Leadership Exchange for Adolescent Health Promotion. And we did a presentation like this one for our state teams. And one of our states shared how they're connecting with parents to address pushback around sex education. And part of the discourse in their state is that sex education is trying to take away parents' rights and abilities to talk with children about these topics. And so the representative from that state team shared that this year, one of the things they developed were these series of guides that covered all of the standards within their state. And within that guide, there was a section on what can parents do. And I've clipped a piece of it here. And in the area on sexual health education, one of the key action steps was for parents to talk about their values and beliefs. And so you see that here in this third bullet. So discuss your family's values and expectations around substance use and consequences of decisions. Talk with them about these pieces. And what that state representative said is that, we're really only covering the medically accurate information, the stuff about values and how people want their children to approach relationships, that's on parents. And so she had this really clear distinction of kind of what the role for this potential group of critiquers was, and kind of said, no, actually, we aren't trying to take away your ability to talk with your kids. We're covering some of this type of knowledge that you can really focus on these things that are important to you. And so I really loved seeing this guide. In terms of the input when possible, they actually developed this with in partnership with their state's parent-teacher association. So not only did they have, not only was this something that was targeted for parents, they actually worked with parents themselves to help make this resource so that it would be as understandable and clear as possible. So when you can, really gathering those stakeholders and getting their input, especially around communications, and especially if you have any that represent your particular audiences, that can be really powerful when working on messaging for misinformation, or to address misinformation. All right. So I know that that was a lot of information, but we're going to take some time to practice. So in a minute, you all are going to be split into smaller breakout rooms. And in your breakout rooms, you'll be given a scenario where some misinformation is being shared about an adolescent pregnancy prevention program, as well as some of the resources available to kind of help address that misinformation. Your group will have about 8 minutes to discuss the scenario and come up with 1 to 2 messages that you want to share to address that misinformation. So kind of keep the 5 tips that we had and that I just shared in mind as you're crafting these through. After the 8 minutes is up, we'll come back together to share our thoughts. So I will turn it over to the RTI team to split us up into our breakout rooms.
All right, everyone should be whisked away to their breakout rooms now. If it does not do so, check the lower Zoom toolbar for either the more options or the breakout room icon. Everyone should be assigned to a room at this point. All right, I think you're good.
Great. I see it. Yep. Perfect. So thank you all for your discussions. I'll go ahead and see if group 1 wants to share. So LaShantania, if you want to or whoever was in scenario 1, that would be great.
Sure, thank you. So we had scenario 1, and just to give a little bit of background real quick, pretty much there was misinformation being circulated online, wanting the students to focus on those core classes in their school system instead of APP programming. So what we discussed was, since it was circulating online, specifically Facebook, that we would create some type of graphic to respond to the misinformation on Facebook, but we also discussed having something put in the newspaper, since it started off as a newspaper clipping that was circulated on Facebook, also respond that way as well. But we had a lot of great conversations in my group, a lot of great ideas, great commentary. So yeah.
Perfect. Thank you. Group 2, Asari or Katie, if you all would like to share.
Yes. So in our group, our scenario was basically that the principals were kind of anticipating that parents would, they're being a little bit hesitant about having programming in the schools because of something that happened, an article that was spread on a national level, even though they have the data to show that parents are really in support of sexual health education in schools. And so in our group, we didn't get a chance to talk about messaging per se, but they really spoke about the consequences of just focusing on a national platform and really trying to help the principals understand that our community context and what's relevant here, and not getting stuck on what is happening on a national level, which may not even be rooted in data and facts. And not jumping the gun to make something an issue that isn't an issue in their community. And so their messaging would be really towards schools, Board of Ed, principals, and just referring back to the data that they do have, that parents are actually in support of the program.
Thank you. All right, so for scenario 3, basically this was at a state education agency, and that one of their colleagues came to them showing a copy of a consent form that parents had been turning into schools. And the consent form kind of was saying that parents' rights are being stripped away. And it was like a consent form that's not normally used in any of the districts. And when the people at the state agency kind of took a closer look at the consent form, it brought them to a think tank website, and that talked about how parents' rights to influence their child's education were being stripped away. And then that form and website were being shared on an online parent discussion board. And so we had some great conversation about like who we would target and kind of what else we might need to know. Someone said that they would like to know if in these schools, are they hosting things like parent nights where they are building those strong relationships? Someone else wanted to know, like, is this really coming from parents and even parents that go to these schools or somewhere else? And then we had a good conversation about who we would actually target. So as the group, we decided that we wouldn't target necessarily the think tank that was distributing the consent form, because we didn't think that their minds would necessarily change. Like, obviously they have a vested interest in trying to kind of share some of this information. And so instead they said what's probably more important is to reach the actual parents with the right things. And we talked about, someone mentioned that they had they post things like consent forms to the students' schools' websites, to the county health department has a page like, here's where you can get the most up-to-date forms. Someone said that they had a text messaging and email service to reach a bunch of parents at once. And so these were some of the great platforms to really target, so that the correct consent forms and the correct information was being given to parents, rather than trying to tackle this other group who may not be influenced. So great, thank you everyone. I don't think it wasn't sharing my screen anymore, but I will share again. Great, so hopefully that practice was helpful, and I'm pretty sure that you all have cluster calls coming in the new year, and so there will be even more discussion about kind of how to do this work. And so we touched on this a little bit in your practice sessions, but we're now going to kind of go over how to disseminate effectively. So our first set of tips was really around how do we make messages that will address what the misinformation that's being shared. And this portion is kind of looking at how can we make sure that the messages we've made reach the people that we want to reach. So for those of you working in large state offices, you may have the benefit of a communications team that can support you in your efforts, but that might not be true for everyone on this call. Still, the job of making sure that people understand your programs is part of your role as a coordinator. Right. So tip number one for engaging audiences, we want to leverage partners to choose the right messengers. So if you all remember that Mentimeter that we did earlier, you said I asked you the question of who are the best people to reach those decision makers about adolescent pregnancy prevention programs. And you highlighted people like youth and parents and educators. And choosing the right messengers is really important because one of the ways that we evaluate whether information is accurate is whether the messengers themselves seem trustworthy. And people are more likely to trust those closest to them. And so I think it makes a lot of sense that you all said that youth and parents were kind of the top people who could maybe get the ear of decision makers. And so that might also mean that you're really talking about messengers at the local level rather than someone at the state level kind of communicating from the top down. Another thing to consider is that people also trust information that comes from those like them. So this is where something like peer networks can be really powerful. So for example, principals or local education agencies may wish to hear from principals or districts nearby about how an adolescent pregnancy prevention program has benefited students in those areas rather than an example that's covering a whole state or like a district that's less similar to them. I will make one note, since youth was one of the groups that was flagged as potentially being a good messenger, is in terms of equipping youth, you want to make sure to really support them in their messaging and make sure that they have the skills and the prep to convey their points well, and also that they feel supported when responding, especially because we know sometimes with misinformation, people can get really heated. And so you just want to make sure to protect youth from that and kind of that they, they're taking the time to share their personal experiences, and ensuring that they have a safe space to do so is important. So our second tip is to share the correct information early and often. So in addition to finding the right messengers, you want to make sure the correct information gets shared as quickly and as often as possible. And so that means consistently repeating corrected information, and doing so early keeps it from spiraling out of control within a community. So recognizing that many of you are working in agencies where communications language might need to be reviewed or cleared, that kind of might mean that if misinformation does start to spread, it can be kind of difficult to respond quickly if you don't have the talking points already in place, because essentially it'll be like waiting for stuff to get cleared, and in the meantime, the misinformation is circulating. So one way to kind of tackle that is to develop something like a messaging toolkit. So it's like a single document that provides the main talking points about your programs, which can include things like what information is covered, who it reaches, its impact, and kind of compiling that into one document even before misinformation hits, and just having it ready and on hand is a great way to kind of make sure that everyone can stay consistent and that you're kind of not caught, what's the metaphor, like caught on the wrong foot. it also has the added benefit that if you have this single document, it's something that can be shared across partners and allies so that people apart from you are also able to talk about adolescent pregnancy prevention work, and they can reinforce your messaging. And so that brings us to our last tip. You actually can prevent the spread of misinformation before it begins. So if people are equipped with the correct information before they're exposed to the misinformation, that misinformation is less likely to take root because the information that's correct is going to be the thing that feels more familiar to them. So we're going to hear now from Georgia, who has a great example about how they've engaged their stakeholders and leveraged partnerships and how that's helped them prevent misinformation in their state. So I'm going to turn it over to LaShawn Tania.
Thank you, Kaylar. Hi everyone, my name is LaShawn Tanias, and as already mentioned, I'm going to be talking about how we down here in Georgia, or I guess down here depending on where you're at, how we utilize our partners to combat misinformation. So if you can go to the next slide. Thank you. We have that bar back on the screen. Thank you. So first I want to discuss how we were able to develop our partnership. So I'm going to be highlighting 3. So first we'll start off with Georgia State University, who are our external evaluators. It's a team of 6. They submitted an application during the 2010 request for proposal that we put out, and they were selected as our external evaluators of the Georgia Prep program. We also partner with the Georgia Campaign for Adolescent Power and Potential, which I will use the term GCAP moving forward. They are our training and technical assistance providers. We contracted with GCAP to do trainings and TA because they are the leaders in our state here in Georgia during and still are during our establishment of the actual PrEP grant. They were founded by Jane Fonda, fun fact. They are a statewide initiative who promotes, teen pregnancy prevention prior to the launching of the PrEP program. And then lastly, we have Banyan Communications, who is our campaign developer. They also created our lovely logo, which you can see here in the left-hand corner there. So our partnership with Banyan started because we already utilized them in the Division of Family and Children Services. They worked on our Child Abuse and Neglect Prevention program, which we call CANUP. They are experts in the community who have worked with national organizations, including the DFACS PCS section, to work on a lot of campaigns, not just APP, but as I mentioned, CANUP as well. You can go to the next slide. So what are the techniques that we use to combat misinformation? So with Georgia State University, they create new tools to leverage accessible data and present data effectively. With GCAP, of course, they host our trainings and webinars to prevent and correct information. And then Banyan Communications expands our digital reach by way of branding, campaigns, and call to actions. Next slide. So I'll start off with discussing Georgia State University by how we leverage our data. So GSU actually recently created the Georgia Performance Measures Management System Record Keeping, very long name, which we abbreviate to GAPR. This is a system where our providers can track all of their data for all of their different implementation sites and cohorts. Of course, expanding our research that deepens the understanding of Georgia PrEP program. So these screenshots here are obviously just taken from last fiscal year. So this is all of our providers have access to this data here. So it shows them the number of young people who were in foster care, who were pregnanting or parenting, who were involved with DJJ or part of the LGBTQIA+ community. We also break down some of that survey data that we are required to have, right? So we look at both entry and exit surveys just on 3 main topics, whether it's about abstaining from sex, delaying sex, or using protection if they are engaging in any sexual activities. We can go to the next slide. And then effectively presenting this data. So once again, we do utilize statewide Georgia PrEP data to showcase the success, challenges, and overall outcomes of PrEP programming. And so these screenshots were from our last sub-awardee wrap-up, which we host annually each year for all of our sub-recipients, all of our facilitators, program admins, and staff, just to let them know how we did overall as a state, who we reached, and then we also do a comparison of our current year and then the year before, so they can see how well we did or ways that we may need improvement. And they do get access to all of this, so they can take it back to their communities, whether they're implementing in a school system, community-based organization, faith-based organization, and present this data of how well the PrEP program is actually doing. Next slide, please. Okay, so with GCAP, they serve, as I stated, as the expert in APP and youth development in Georgia. Our partnership with GCAP allows us to host connected caregiver trainings, parent toolkits, and then getting to outcome models. Oops. So our connected caregiver training series is open to Georgia foster care providers and foster parents to increase their knowledge, build skills, and improve attitudes about talking openly and accurately about teen pregnancy prevention, sexual health, healthy relationships, and making responsible decisions. Those trainings are virtual and anyone can attend. So we send out a very big email blast to all of our contacts, our sub-recipients, and then also we do get our state-based communications team to email this out to the listserv as well. So anyone has access to these trainings to attend. And then the getting to outcomes, I'm going to talk about the parent toolkits later, but the getting to outcomes framework is to select, implement and evaluate evidence-based teen pregnancy prevention programs. So that way our providers know which curricula, best fits their target population. You can go to the next slide now. So this is our parent toolkit that GCAP created. It provides practical strategies and information to help parents, guardians, and caregivers navigate topics and situations that all families face. So it's not just based on adolescent pregnancy prevention. As you can see, we have things about dating violence, healthy relationships, teen mental health, driving safety tips. So it's a really comprehensive toolkit. Anyone has access to this. It's also hosted on GCAP's website as well. So if anyone stumbles across the GCAP website, they can also utilize this as well. You can go to the next slide. Thank you. So our digital reach, so our partnership with Banyan Communications has produced our APP logo. So we do have both the PrEP grant and SRAE grant, and they have created logos for both. And then we have one overall APP logo as well. They are developing a web page for us. I think Kaylar mentioned that, you know, a lot of us state grantees, we have to go through so many different approval processes to get things, you know, finalized. So we are in that approvals process right now with our web page. They've also created campaigns which have been led by youth voices, mainly from the PrEP program, and discussion guides. You can go to the next slide. So I'm going to highlight one of our campaigns, which is the My Goals, My Life campaign. So why we decided to go this route, we wanted something that was real, relatable, genuine, and inclusive into teen minds regarding healthy dating, relationships, and pregnancy prevention. We wanted to bring to life a student-made production with peers discussing the above topics. And we wanted the look and feel to be student-created and led, with added post-production effects inspired by social media. So how did we do this, right? So we conducted 4 focus groups with one of our local high schools who is also a PrEP recipient. Those focus groups took place during their lunch breaks, lasting about 25 minutes. And we had about 3 to 9 participants in each group. And our participants represented a cross-section of students of color, from African American, Latino origin, and then of course across gender and grade level. Next slide. Okay, so here is the clip that Kaylar is going to play for us. I believe it's about 3 minutes, and then we'll come back and talk a little bit more.
Hey guys, today we're going to be talking about healthy relationships. We got a lot going on. We got some of my classmates and peers coming in to talk about it. So I'm very excited. This is going to be very awesome. we're about to get ready for the day, so see y'all.
Hey, how you doing? I honestly feel like dating is finding a person that you share a lot with, not really calling each other boyfriend and girlfriend, but being like, you know that you can depend on that person.
I define dating as me and another partner committing to our future.
Being with a partner, they're not just your friend, but you're more close to them.
I recently just got out of one. What made it unhealthy is that this relationship took place from 8th grade till now-ish. The person, that you call a best friend, supposed to be your ride or die buddy, y'all got each other's back, this and that, but I was the one who was giving all of the, energy.
An unsafe relationship would be as if someone or your partner would be threatening you mentally, sometimes maybe even physically, playing with you, not the way you want it, and it just feels very unsafe.
Mentally, an unsafe relationship is you being in a relationship with somebody and them constantly bringing you down. I feel like I've learned to basically set my boundaries and know how to stick up for myself.
A healthy relationship looks like when everybody is happy together.
They treat you right, they don't hit on you, they talk to you nice. Y'all are able to make it through problems without getting physical and stuff like that.
Bottom line is yourself. You are yourself, period. You wake up and see who? You. So who else is gonna be there for you? Nobody but you. So you have to make sure that your relationship with yourself is great.
All right, y'all, now it's your turn. Tell me what a future healthy relationship looks like and post it with the hashtag below.
A healthy future relationship for me would be someone who is always there for me, supporting me.
Trust and communication, because that's what it's built off of.
Just supporting and uplifting the other person.
You can talk to each other about anything and everything. You have to know your boundaries and you self-respect.
Respects my boundaries and I respect theirs.
Having trust in a relationship, to any type of relationship, will allow this person to put forth commitment.
It's about being able to be yourself with someone else.
You don't have to change yourself for another person. Just be you.
Thank you. You can go to the next slide. Okay, before we go into the discussion guide, I just wanted to also say that our overall goal, of course, for this campaign was to engage all teens in Georgia to promote healthy relationships and decision-making, which we kind of saw, help increase the number of teens who abstain from sex, and then ultimately reduce unplanned pregnancies among Georgia. So I discussed earlier, Banyan Communications also developed a discussion guide to accompany the video. So that clip was 3 minutes, but we do have shorter clips for our providers to utilize in school settings or whatever setting that they may be implementing PrEP programming. So once they display the video, the discussion guide assists them with facilitating talkback sessions around healthy relationships, and then it just serves as a motivational tool, to help students create their own videos. So to use this discussion guide, right, it starts and deepens the conversations about healthy dating skills that are safe and respectful for all teens. It also strengthens not just the PrEP program, but also the SRAE curricula and learning objectives as well. And it does include setting the stage, questions, facilitation tips, selfie video recording steps, and etc. You can go to the next slide, thank you. So our release phases, so we had 2 different release phases for this campaign. So the first one was in May 2020, which was National Teen Pregnancy Prevention Month. We had targeted promotions by platform to reach audiences in Georgia through May through June. And that was Instagram and YouTube, because we know that's where the young people typically are. And then we utilized Facebook because that's where a lot of the educators, school professionals, youth and family serving organizations, as well as parents may be. Our second phase was a relaunch, right? So we relaunched the PSA, which was in 2021, right around back to school time. We utilized Instagram and YouTube, as well as targeted paid promotions for teens, right? So we had ads running across different social media platforms. Still, we utilize Facebook promotions for youth and families and adolescent health professionals, and then we released the discussion guide in our second phase. So our results, right? So our Instagram results showed us that the campaign reached more female teens on Instagram than it did male teens, around about 18% higher volume for our female teens. However, although the campaign reached more female teens, male teens visited the website from Instagram at a higher rate, around 3% more than our female teens. The longer 30-second PSA, which was the cut down of the video that we just watched, had higher performance than any of the other cut downs. I think 30 seconds was a really nice bit for people to digest. So it had more reach and more clicks. And then on YouTube, our ads reached 8% more female teens. And although the campaign reached more female teens, once again, male teens visited the website from YouTube at a higher rate, this time at 12% more clicks. The click-through rate for male teens was about 0.71% higher than the industry standard of 0.65 for government and advocacy at the time of evaluation. Next slide. Oh, that was it. So if you have any questions, I've listed my contact information here. Also, my unit manager, she wasn't able to attend. But if you have any questions, comments, or concerns, you can definitely send me an email. Thank you. You're muted.
You're muted, Kayla.
Thanks so much. Thanks, everyone. And thank you, LaShantania. I just want to say we're in the question and answer portion of the webinar. And, you know, I think what's really great about LaShantania's example is that strategy of like that large push out, especially those ads and everything. So it's not only accomplishing the goals of their program, but it's giving people some really great familiarity with their work on the SPREP and the SRAE programs that are funded in the state of Georgia. And so I think that name recognition probably helps a lot in making sure that people have a sense of what the program is doing. So are there any questions in the chat? Oh, here we go.
I don't see any questions in the chat, but I would welcome folks to put their questions in. Oh, Heidi, the first question is about when the recordings will be available. We are planning to post the recording from session 1 this week. So we'll be on the lookout for that. It will be on the exchange and will show up as a new resource. And then we will post the recording from the session today as soon as we can. It will likely be, you know, in early January in the first 2 weeks. And she said that they're dealing with a disinformation campaign, and this would be helpful for all your sub-recipients. That's great. I do want to put in a shameless plug for our training and technical assistance as well, Heidi. If you'd like some individualized support to help think through that campaign, you know, think through kind of like messages that you could develop or how to support your sub-recipients, you're welcome to email us at apptta@rti.org and tell your project officer that you'd like some support. We'd be more than happy to help you with that as well. And I will say we are going to try to get the slides out in the thank you e-blast for this. So you will have access to the non-508 compliance slides, and then we'll get the 508 compliance slides to you as soon as we can as well. I know our small group was kind of just getting going, but there were a lot of really great strategies shared. And I think I have a quick question for you, LaShantania. How did you all decide to prioritize? You know, there's so many different things that we could use our funding for. Can you walk us through a little bit about why you all decided that this was important and how you were able to prioritize resources for the campaign you presented on?
Sure. So we realized this was important. Obviously, Georgia is a southern state. So we deal with a lot of misinformation as well. Here also, I think just politically, there was a lot going on, and we wanted our stakeholders, parents, the school system, anyone who heard about PrEP or Title V SRAE, we want them to know that it's not just about sex, that your young people is learning so much more than just that, right? About healthy relationships, setting goals, so on and so forth. So that's how the idea just kind of sparked, like, what can we do to show them that we're doing so much more than what they think that we're doing. As far as funding, it was a collaborative effort between both grants, PrEP and SRAE. And that's just kind of how that works. And I think we already had an established relationship with Banyan. So it was kind of easy just to pull together, or not really pull together, to tap them on their shoulder and say, hey, we have an idea. Would you be able to help us bring it to life? And they executed it beautifully.
Awesome, thank you.
I'm looking at some of the questions submitted from the registration form, and I noticed that there was one in here about how to navigate disruptive open meetings. I think that's something that's definitely challenging. And I don't know that we've, even among our state teams on the LEAP program, that has been a big question for them as well. I think some of it includes kind of like trying to get a sense of like who's coming to the meetings, and maybe like trying to figure out if there are ways to, I think some of the things we've recommended is like, is there a way to mobilize the local community? Because what I think they have said is that the people attending and disrupting meetings aren't even people who are necessarily from that community. And so they kind of take up the airspace. And so I think trying to find ways of like figuring out and connecting with those who are in your respective districts, like empowering them to feel comfortable speaking up. And I think that's something where like a messaging guide or like just some like quick facts that they can easily turn to can be really helpful, because I think it can be really daunting for someone to figure out what to say in the moment. But if there is something written out and that they can have as a cheat sheet to go back to, that really helps a lot.
And I think part of it is also reminding people of when meetings are happening too. Just reminding people like what is happening, how their support can make a difference, because I think everyone has a lot going on. And so how do we help convey, especially to our stakeholders who are really supportive of our programs, they might not know some of the challenges. I think that those are really great points.
Yeah, that is also a very helpful thing too, to let people know when stuff is happening as well.
What are some strategies that you've seen, Kaylor, to increase community engagement as we're kind of emerging from the pandemic, but still in the pandemic, if that makes sense?
Yeah, no, that's definitely a great question. I think something that all sectors are struggling with. I think that transition has been really rough for people. And so I think maybe one of those things to be mindful of is the ways that we connected in the pandemic are probably not going away. Like, I think it would be easy to think like, oh, the pandemic's over, we're gonna do everything in person now, but that might not be true. And in some ways, the pandemic helped increase accessibility for certain groups of people. And so not tossing out those strategies and trying to figure out how to balance that against the in-person meetings, I think can be really helpful. I think there's also just this general desire for connectivity. And so I think one of the running jokes is like, if you're trying to get people to come in person, like food is always a really good way to encourage people to come. I think too, also probably similar to how you would approach getting participation in your programs if you're trying to meet in person. Like, what are the barriers that people have to participating live and in and together? So like if that means, you know, childcare might be something to consider, or transportation, those things existed before the pandemic and they exist now too.
Awesome. Thank you. I'm just looking at the list of questions that we received in advance, and there are a lot of questions about messaging and increasing confidence in discussing programming and how do we frame teen pregnancy prevention programming. And so I want to let you know kind of what we have coming up in terms of TA events. We will have a grantee share and learn session on January 31st that will focus on misinformation. That will provide an opportunity to connect with the speakers from our webinars that we've had, and also to develop, we'll have some action planning tools for how you can think about what are some steps that you want to take in your own community with particular audiences to begin addressing misinformation or kind of preventing it before it might start. And then we will also be having a webinar followed by an action share and learn session around messaging and communication. So I think the exact way that you might want to frame teen pregnancy prevention or the programming in your community will depend a bit on your community context. And so we welcome you to bring kind of those examples, and we'll be having an opportunity to think about what is the framing that's really important. But a key aspect of that will be having a pulse on what are the key important things in your community. What are the key challenges that the community is facing, and where are the opportunities where people are coming together to solve those challenges, and how does the work through the prep programming kind of fit in with that work. Are there any other questions that folks have before we adjourn?
I think I saw Millie had her hand or had their hand up, but maybe that was a fluke.
Awesome. Well, we'll be popping the evaluation link into the chat so that you can fill out the evaluation. That's also an opportunity to tell us kind of what more do you want to hear about. There are a number of resources, so you can access that evaluation either through the QR code. There are a number of resources out there about misinformation. We also have a number of resources on the exchange about communicating about your program. And I did want to highlight, we have something called the Studio tool. If you have seen that on the exchange but haven't used it yet, I would encourage you to go in there. There is an opportunity for you to tailor fact sheets about your program. So the data in there are pulled on kind of the most recent teen birth rates for your state, and then information about what your program might be doing. If the information about what your programming is doing has been updated or you've added to it, that those fields are editable, but it's an opportunity to kind of like, there's an already designed tip sheet, you're able to put your logo on it, and it has some fields that are pre-populated. So if that's helpful as a tool for sharing with community members about your programming, we would welcome you to use that. And if you don't know how to use it, or you're getting stuck somewhere, we're happy to help you with that as well. I'll put our email in here so you can reach us at any time. And with that, I wish you all a wonderful end to 2022 and look forward to continuing to work with you in 2023. And I hope that, this was helpful and that everyone has a nice restful end of the year. Thank you so much to our speakers and to all the participants for all your time today.
Thank you, everyone.
Thank you.